Well, developing tonight, billions in healthcare investments are at stake over healthcare legislation currently making its way through the Capitol. Leaders at the Mayo Clinic are very against some of the reforms being proposed. Danny Spiewak is here now to explain what's happening. Danny?
Well, Julie, this session at the Capitol, DFL leaders in both the House and Senate have advanced two different bills related to nurse staffing and healthcare affordability. They're now refining those bills in budget legislation to send to Governor Walz for a signature. But now a huge twist here, as Mayo Clinic is now threatening to pull a $1 billion investment in Minnesota if those bills do pass.
Mayo Clinic rocked state government this week with a message to DFL leaders.
When we received this ultimatum, I was very surprised.
In an email first reported by the Minnesota Reformer, which we've now independently confirmed, Mayo threatened to take an undisclosed $1 billion construction project to other states if lawmakers move forward with two health care bills.
Conversations need to happen fast.
DFL Representative Sandra Feist authored one of the bills that Mayo is opposing, which seeks to keep patient loads down by putting more nurses on hospital staffing committees. The other would establish a healthcare affordability board. Mayo says both would negatively impact access to care.
The language that Mayo has provided would exempt nearly, if not all, hospitals in Minnesota and would make the rest of the bill pointless.
But Republicans who've opposed the staffing bill this session, like Senator Paul Utke,
this bill will dramatically increase health care costs.
Rush to Mayo's defense. Utke said in a statement that DFL leaders are using reckless abandon that makes even the most loyal hometown businesses reconsider. But Minnesota Nurses Association President Mary Turner puts the blame on Mayo.
To have at the last minute, corporate, healthcare, big business come swooping in and basically holding our state hostage is despicable. And it is a dirty politics.
Meanwhile, negotiations continue at the Capitol on both bills, including the staffing measure.
If they will come back to the table, I am sure that we can work together to find language that ensures that this bill achieves its goal and also can address Mayo's concerns.
Today, Governor Walz said that he doesn't know the specifics of Mayo's planned investments, but he says he's had conversations with Mayo Clinic in recent weeks and has confidence that these sides can come to a compromise. Back to you.